Carl Rogers believed that every person has an innate tendency toward growth. The therapist's job was not to analyze, interpret, or advise, but simply to provide the conditions under which growth naturally occurs: unconditional positive regard, empathy, and genuine authenticity. It sounds simple. Doing it well is extraordinarily difficult. The history of psychotherapy is dominated by individual treatment, but group therapy has existed since the early 20th century and offers both unique therapeutic factors and economic advantages. Group therapy is not a lesser substitute for individual therapy. It provides experiences that individual therapy cannot replicate. Carl Rogers' person-centered therapy holds that psychological distress results from incongruence between the actual self and the ideal self, often created by conditional acceptance in childhood. Healing occurs in a relationship where the therapist offers unconditional positive regard, accepting the client without judgment, genuine empathy, and personal congruence, authentic transparency. The primary technique in person-centered therapy is reflection. The therapist accurately mirrors the emotional content of what the client has said, helping the client clarify and deepen their own self-understanding. Unlike interpretation, which imposes the therapist's framework, reflection starts and stays within the client's own frame of reference. Person-centered therapy is explicitly non-directive. The therapist does not give advice, set homework, or guide toward specific insights. The client determines what is talked about, at what pace, and toward what end. Rogers believed that the client's own actualizing tendency, the inherent drive toward growth, would guide the process if conditions were right. Yalom identified 11 therapeutic factors in group therapy. Universality, discovering that others share your struggles, reduces isolation and shame. Altruism, helping others in the group, boosts self-esteem. Interpersonal learning, practicing new social behaviors in a safe environment, is unavailable in individual therapy. The group itself is the therapeutic instrument. Marsha Linehan developed dialectical behavior therapy for borderline personality disorder, characterized by intense emotional dysregulation, self-harm, and suicidal behavior. DBT combines cognitive behavioral techniques with acceptance strategies drawn from Zen Buddhism. The core dialectic is between validation and change, accepting the client while pushing for growth. The rapid expansion of teletherapy during the COVID-19 pandemic generated extensive research on video-delivered psychotherapy. Meta-analyses show that video therapy is as effective as in-person therapy for depression, anxiety, PTSD, and OCD, with equivalent dropout rates and therapeutic alliance quality. Teletherapy dramatically expands access for those with mobility, geography, or stigma barriers.